There have been any number of triumphs out there. They're less reported, but there have been a number of bottlenecks, both at the national and at the local level. Nationally, there sometimes has been uncertainty in vaccine shipments. The locals are not exactly sure when the vaccine will arrive. The first challenges, of course, came with the Pfizer vaccine that requires a really deep freeze in order to keep it stable and intact. And that meant that that vaccine could only be distributed to certain large medical centers, such as our own, and I assume Dr. Wachter's, where there were appropriate freezers and, even more important, personnel who were trained to handle such deep freeze material. That made it difficult to spread the vaccine out. Now, some of that has been ameliorated with the Moderna vaccine, which came along a little bit later. And we're now using that for distribution to our nursing home facilities, to local health departments, smaller community hospitals. But that all took time. And then I'll just mention one or two other little things. I think, quite frankly, some of the locations thought this was going to be just another flu vaccine campaign. They didn't prepare sufficiently.
I guess I'm not surprised that we're not doing very well, because the only parts of COVID that we've done well on were the discovery of the vaccine. So we get the science right. We do not seem to get the logistics, the politics, the sociology, and all of the other components that have to come together right. I think they didn't quite appreciate the complexity of the process. They then handed off a fair amount of the responsibility to local institutions, all of which were doing improv, inventing this on their own. And it is one of the things that happens, I think, when there's a lack of national guidance, there's just too much wiggle room. And I think that's what we've seen. Once we knew we had vaccines, we didn't appreciate the complexity. And we're seeing what that looks like. I think that where we are now is kind of scandalous. I mean, it really is. If you think about the national average, is that we have been able to vaccinate, we've been able to inject 30% of the vaccine doses that have been distributed. That's just a number, but that represents millions of people that should have received vaccine by now, that if they received it more than 10 days ago would be at least partly protected by now. I don't think we treated this as the emergency that it is. If think about a 9/11 worth of people dying a day, or a Pearl Harbor worth of people dying a day, we would have attacked that as an absolute emergency. And I think we attacked the development of the vaccine as an emergency, but we've attacked the distribution of the vaccine as a relatively routine process that we'll kind of stumble around until we figure out the right answer. And that clearly has not worked very well.